Welcome to WGTV. I'm Eric Curry. We have several stories lined up for you today. We'll share with you details about a transit plan that would redefine the way we think of mass transit in Wake County. Plus, we'll learn how to avoid the health dangers lurking in the summer months. But first, for months, Wake County staff and its community partners collected data and gained public input to identify the top 4 issues they will focus on to improve the health and well-being of county residents over the next 3 years. The Community Health Needs Assessment targets the top priorities of health insurance coverage, transportation, access to health services, and mental health and substance abuse. Joining us to talk about this assessment are Dr. James West, Chair of the Wake County Board of Commissioners, and Donald Gentzig, President and CEO of Wake Med Hospitals. Thank you both for being here.
Pleasure.
Dr. West, can you talk about the Community Health Needs Assessment? What is it and what does it tell us?
Yes, Eric. The Community Needs Health Assessment is a process that we've been doing for a while, every 3 years, to make sure that we stay on the cutting edge in terms of analyzing the health and wellness of Wake County. We focus on issues that affect health and well-being, to include looking at the resources that may be needed, designing a plan of action to make sure that we're addressing those issues, and also it's collaborative in scope with Wake County, our local hospitals, as well as community partners being engaged in this very dynamic process.
Mr. Gentzig, why is this health assessment so important to the community?
Well, our commitment as a community is to help address the health needs of its population. And so this is building upon a collaborative partnership, as Dr. West mentioned, between a lot of nonprofit community organizations, local and county government along those lines, to help address and identify the key areas that we want to work together to try to improve upon.
Now, Dr. West, I understand the 2016 assessment report was released in June. What did it say?
Well, after months of data collection, analysis, and making sure that we have identified those things that will have the greatest impact, we identified 4 top issues, those being access to health services, mental health, substance abuse, transportation, and also health coverage.
And how will these 4 issues be addressed?
These issues will be addressed through a programmatic response that will include a good plan, looking at the implementation strategies, evaluation, and making sure that it's a participatory process. And more specifically, we will be looking at action plans in terms of clear goals and objectives and strategies to make sure that we bring about a positive change in terms of not only making sure that we maintain good health and well-being in the county, but to make sure that we have a better environment for a good quality of life and healthy citizens in Wake County.
And Mr. Gentzig, obviously this assessment, it's a county community initiative. How can the community get involved in making sure that this assessment is as accurate as possible?
Well, they've been a tremendous help so far in getting together and giving input, participating in group efforts. And as Dr. West mentioned, we're now at the point that we're going to take the information that we've gotten. We've narrowed it down to some key areas that we're working on, and the community can help by participating as we start to formulate the action plans, the next steps. So there'll be community health assessment teams that come together that organizes itself around these 4 priorities, and participation from our community, building upon what they've already shared with us, is going to be very helpful as we move forward to really make a difference and improve the health of our environment and community.
Mr. Gentzig, Dr. West, thank you so much for being here.
Thank you.
When we return, we'll share with you what's being done to address transit in Wake County. Stay tuned.